Radiotherapy is the use of high-energy X-rays and other rays, such as electrons, to treat disease. Since the discovery of X-rays over 100 years ago, radiation has been used more and more in medicine, either for diagnosis by taking pictures with X-rays or as treatment in the form of radiotherapy. While radiation obviously needs to be used carefully, doctors and radiographers have a lot of experience in its use in medicine. Many people with cancer will have radiotherapy as part of their treatment. This can be given either as external radiotherapy from outside the body using X-rays or from within the body as internal radiotherapy. Radiotherapy works by destroying cancer cells in the treated area. Although normal cells may also be damaged, they can usually repair themselves. Radiotherapy can cure some cancers but can also prevent the chance of a cancer coming back after surgery. It may also be used to reduce the symptoms of cancer. In this programme, we hear the views of Sarah James, Professional Officer in Radiotherapy at the Society and College of Radiographers, who explains the differences between therapeutic radiographers, who provide radiation treatments to patients, most of whom have been diagnosed with cancer, and diagnostic radiographers, who work mainly within the radiology and imaging departments of hospitals within NHS trusts or the private sector. We also hear from the National Radiotherapy Implementation Group, who say the delivery of a world-class radiotherapy service requires implementation of advanced technology to allow clinicians to deliver the best outcomes for patients. Radiotherapy innovators Oncology Systems Limited and Varian Medical Systems explain how their continual research and development provides the healthcare sector with state-of-the-art technology for the best possible treatment of cancer.
Therapeutic radiographers are responsible for delivering radiation treatments to individual patients, most of whom have been diagnosed with cancer. They're also responsible for the physical and psychosocial well-being of patients before they start treatment, during the treatment course and then afterwards. They provide information and support to patients, and they assist patients with making informed decisions about their treatments and about their management and care generally. Diagnostic radiographers work mainly in radiology or imaging departments. They're responsible for operating the equipment when examinations are taken to diagnose illnesses. There's a variety of modalities such as plain X-rays, CT scanning, magnetic resonance imaging and ultrasound. And for some of those modalities, diagnostic radiographers are also responsible for interpreting the images which are taken as part of the examination.
Cancer is a disease that affects a significant proportion of our population, and treating it remains one of the main challenges to our clinical and commissioning services. The role of radiotherapy in the treatment and cure of cancer has been previously underestimated. Radiotherapy is a significant component in the treatment of at least 40% of all patients who are cured of their cancer. Radiotherapy is a cost-effective service, being cheaper than chemotherapy and on a par with surgery. Radiotherapy is clinically effective, with an important role to play, second only to surgery, in both curative treatment and palliation of cancer. The National Radiotherapy Advisory Group published their report in May 2007. Called Radiotherapy, Developing a World-Class Service for England, it set out the strategy to close the gap in radiotherapy provision and move towards world-class radiotherapy services. The Cancer Reform Strategy, published in December 2007, set out the actions that the Department of Health is taking to implement the NRAG report. The 10-year aim is to provide world-class radiotherapy in England. This means having adequate capacity and abolishing waits for treatment and developing new treatment technologies that will improve survival. From the end of December this year, patients should expect their radiotherapy to begin in less than 31 days from the date of agreeing their treatment with their oncologist. This should include all of their treatment planning and preparation. In addition to this, we're expanding the capacity of radiotherapy provision such that all patients who would benefit from this key service will have access to it. World-class services should focus on ensuring appropriate and timely access. However, achieving world-class is not just about rapid access, it's also about high clinical standards. So technological development is also necessary to bring our services up to the standard of the best in Europe and the United States. Delivering a world-class radiotherapy service requires us to build both capacity and quality. Building quality within the service requires implementation of newer technologies such as intensity modulated radiotherapy or IMRT and image guided radiotherapy IGRT to allow our clinicians to deliver the best possible outcomes. Building capacity supports timely access and equitable availability for all of our patients. To take forward the Cancer Reform Strategy recommendations, the National Radiotherapy Implementation Group, or NRIG, was set up in 2008. We provide support to service providers and commissioners as they review and develop their radiotherapy plans. The National Radiotherapy Implementation Group is an oversight group. Its role is to direct the work programme to deliver these key changes. World-class radiotherapy requires a much stronger relationship between commissioners and providers. The National Radiotherapy Implementation Group is focused on both service delivery and commissioning.
Radiotherapy is the use of ionising radiation, usually high-energy X-rays, to treat cancer. Radiotherapy is often fractionated, which means that it is given over a number of days. This allows large doses to be given while sparing normal tissues from too many side effects. Generally, radical or curative treatments are given in more treatment fractions than palliative treatments, which are short courses of therapy which aim to relieve symptoms without adding side effects. The most recent development is intensity modulated radiotherapy called IMRT. IMRT can deliver dose distributions which are shaped closely to the tumour and avoid normal tissues. In this example, IMRT is used to deliver treatment to a tumour in the nasopharynx at the back of the nose. The area receiving the highest dose is shown in red. Lymph nodes in the neck are also treated to a lower dose shown in yellow. Non-target tissues receive even lower doses shown in blue, and the dose distributions are closely shaped to the target, and in particular the parotid salivary glands outlined in red and orange are in the low dose region. This will reduce the risk of dry mouth, which otherwise will be an unpleasant long-term complication. This prostate treatment plan shows high dose in the area of the prostate. There is sparing of the rectum, which has been outlined in brown. The pelvic lymph nodes are also treated, and the small bowel situated anteriorly is spared and is highlighted in green. In this treatment for a pelvic sarcoma involving the right iliac bone, the dose distribution is closely shaped to the bone, with reduced dose delivered to the right hip and the pelvic organs. This should reduce the long-term complications and should mean that fertility has been preserved.
Cancer affects 1 in 3 of the population in the UK, with about 250,000 people being diagnosed with cancer each year. More than half of all cancer patients would benefit from treatment with radiotherapy, either for curative or palliative purposes. Radiotherapy contributes to the cure of 40% of those patients diagnosed with cancer who survive 5 years or more, second only to surgery in its curative effectiveness. Major technological developments such as IMRT, which is to be available to patients in every cancer network in England by the year 2012, are improving the accuracy of radiotherapy treatments, sparing normal tissues and opening the door to a reduction in short and long-term side effects. And the implementation of recommendations in the report towards safer radiotherapy is helping to make radiotherapy safer. This process of developments in radiotherapy services moves this country towards delivering a world-class radiotherapy service to which the radiotherapy community aspires and cancer patients deserve. I believe that this will continue as new techniques and developments become available and are proved to be effective and safe.
We recognise that the need for radiotherapy has been previously underestimated, and that capacity in services needs to increase to ensure that all patients who require radiotherapy have appropriate access. Additionally, the Cancer Reform Strategy understood that effective development needs to be underpinned by robust commissioning. The National Cancer Action Team are leading a number of work streams to ensure that the recommendations of the NRAG report and the Cancer Reform Strategy are met, and that services are developed in a sustainable way for the future.
The role of the consultant radiographer is really acting as an expert practitioner in their specialist field within radiography. It really is to lead the profession forward, implement innovation, service redesign, and to act as a resource really for other healthcare professionals both within radiotherapy and outside of the local profession. Consultant radiographers do manage their own patient workload. Really, therapy radiographers at consultant practice level should be taking on a workload that will improve the patient pathway, improve patient outcomes, and really, whilst we're not intending to be doctors, what we're hoping to do is to provide a level of care that has a service need. So really it should be driven from service need.
Oncology Systems Limited is the largest independent supplier of radiotherapy equipment to the NHS and private sector in the UK and Ireland. After surgery, radiotherapy is the most commonly used treatment for cancer and the most successful, and for all forms of treatment, it's the most cost-effective. To deliver a course of radiotherapy requires a lot of preparatory work, which requires, for example, specialised software, a range of accessories, which are usually unseen by the patient, but which culminates in a daily course of radiotherapy treatment on a treatment machine. At OSL, we provide all of this equipment, but we're particularly privileged to supply the most advanced mainstream radiotherapy machine available in the world today, Tomotherapy. Tomotherapy, which is manufactured in Madison, Wisconsin by Tomotherapy Incorporated, represents a true paradigm shift in radiotherapy, having treated its first patient in 2003 in Knoxville, Tennessee. Why is tomotherapy unique? Well, it delivers unprecedented accuracy and precision and has particular safety features. Unlike linear accelerators, machines that were invented in the 1950s and still in use today, tomotherapy is based on modern helical CT scanner technology. It delivers radiation as it continually rotates around the body in a helix with ultra-fast changes in radiation beam intensity. This intensity modulation, or IMRT as it's called, is 100 times faster than other machines and results in more precise shaping of the radiation to match the intricate shape of a tumour and results in fewer side effects for the patient. This also results in less ongoing costs for the health service.
The tomotherapy unit, when it was introduced, was part of a research study within the department, but very quickly proved its worth, and we routinely now use it for treating our head and neck patients, very aggressive tumours which would have been a challenge elsewhere on conventional linear accelerators. The patients may not have actually had radiotherapy because it would have been impossible to deliver. Tomotherapy gives us the opportunity to actually be more prescriptive to the patient and allow us to treat these more difficult cases. The unit itself has also broadened the choice that is available to the medical staff within the department about what type of treatment they wish to deliver, but it also has been driven by patient demand and patient choice. One of the things we have noticed over the last few years is actually patients are much more aware, much more educated about the techniques on offer, and routinely we are asked by the patients if we provide a tomotherapy solution for their tumour type. This has meant that we have taken referrals from all over the UK, including Scotland and Wales on a regular basis, and even from overseas, because we have been the only NHS trust for some years, or for the first 2 years of practice, which is now changing, but that has meant these patients have come to us rather than going to the private sector. After 12 months of clinical practice of the first unit, we were able to choose a second tomotherapy as a second machine, because we felt that it would continue to complement the service that we provided here at Addenbrooke's. It allowed us to continue on along our programme of IMRT and IGRT, and the tomotherapy solution offers an integrated system which you can use within your service effortlessly and seamlessly.
Tomotherapy has, I think, some really important benefits for the NHS as a whole. The first thing is that it provides for the image guidance with IMRT capability in an integrated way. That's been really important in focusing people's attention on the need for these technologies, and it's made the other manufacturers sit up and take notice as well of where they were doing too little in the marketplace. Tomotherapy seems to be very straightforward for patients. They're familiar with the general design of the machine, the circular design, which is like a CT or MRI scanner, of course. And actually the way that it's used here, the patients don't stay in the room for long enough to get bored or upset by it. And my perception is that patients find it very straightforward, in fact. Actually, we treat even some patients who are children on this machine, and if they can manage it, then that's also very good. And overall, I think that we believe that there is a reduction in side effects compared to conventional forms of radiotherapy. And patients perceive that and perceive the technology as providing something for them, as well as experiencing that in a real biological sense.
One advantage of the streamlined process of tomotherapy with having one operator station is that we can actually treat up to 65 patients at present on our 2 tomotherapy units. Our patients are in a 12-minute time slot, so we can treat between 4 and 5 patients an hour, which is very comparable to any other treatment delivery. We here at Addenbrooke's have seen a number of software and hardware developments throughout the last 2.5 years of using tomotherapy, which have helped us again to improve the process for our patients, to streamline the process, and to ensure that our patients have their treatment delivered quicker, so they're not in the room as long and they can get on about with their normal lives.
One of the key features is that we can treat patients that otherwise would have been untreatable. We had a look at our first 100 patients treated on the first Tomo unit, and we estimated that 5% of those patients, that's 5 out of 100, would have been untreatable without these technologies. So that's a very important aspect. Now, some of those patients would receive treatment for palliation of symptoms which otherwise wouldn't have been attempted or offered. And some of those patients were treated with curative intent, where the treatment simply wouldn't have been possible. This actually provides for the very best X-ray radiotherapy that's available anywhere in the world, on any platform. And that delivers outcome improvements for patients, in my view. Tomotherapy is a fantastic tool for doing image-guided IMRT. Of course, what I'm really talking about is the opportunity to provide access to those technologies. But in thinking about that, one needs to make absolutely certain that the machine will do what it says on the tin. And tomotherapy is extremely good. We can image every patient every day, and we can do the imaging every 15 minutes or so, all through the day. And the integration is fantastic. It shows that this machine was designed from the bottom up, actually quite a short time ago, and it really shows in the treatment design and the speed of the integration and operation of the unit.
With over 900 scientific publications today showing that tomotherapy is superior and flexible, we want to ensure that the public, commissioners of healthcare and other medical professions clearly understand how tomotherapy today is providing the most advanced radiotherapy and yet the most cost-effective treatment of cancer available.
We can treat patients that otherwise would have been untreatable. This actually provides the very best X-ray radiotherapy that's available anywhere in the world, on any platform. And that delivers outcome improvements for patients, in my view.
Therapeutic radiographers play a vital role in the treatment of cancer. They have highly specialised skills that work with the other members of the multidisciplinary teams involved in treating cancer and with the patient going along the journey of their treatment. Therapeutic radiographers meet their patients on a daily basis. Some patients may come for up to 8 weeks treatment. So obviously the therapeutic radiographers get to know their patients intimately. They're asked advice on a daily basis. radiographers need to check that the patients are doing well during their treatment. So obviously there's a good relationship built from day one.
1 in 3 people will develop cancer at some stage in their life, and more than half of these people will be treated with radiotherapy. Yet radiotherapy is still probably the least understood form of cancer treatment, despite the many recent advances in speed and precision and increasingly impressive reported outcomes. Varian Medical Systems is the world's leading manufacturer of medical devices and software for the treatment of cancer and other conditions with any form of radiotherapy, whether it's conventional radiotherapy, radiosurgery, proton therapy or brachytherapy. More than 100,000 people a day are treated worldwide on Varian's equipment, so we're a company that touches many people's lives, including the patients here at Ipswich Hospital in the UK, which has a long and proud tradition of offering the most advanced treatments for patients in the local area.
Varian Medical Systems are dedicated to providing the most advanced, efficient and cost-effective forms of cancer treatment. A linear accelerator like this, for example, will cost in excess of £1 million, but it will last 10 years and it will deliver over 100,000 treatments in that 10-year lifetime. The cost of healthcare is a major consideration for economies around the world, and we at Varian Medical Systems strongly believe that developing economies should not be deprived of the most advanced treatments that are available in developed economies. Technological developments are driven by clinical need. TrueBeam, for example, will permit clinicians to use radiosurgery to efficiently treat tumours that may have been previously considered either inoperable or too difficult to treat. The result can be a reduction in the cost of long-term care.
This is the treatment planning system, and it's on this computer that we actually tailor the dose distribution to where we want to treat in the patient. Here we have a prostate patient. What we're trying to do is make sure that the red area is the area that gets the prescribed dose, the dose that the clinician wants to give it, while we're avoiding the other coloured areas which are our organs at risk. So in a prostate patient, that's areas like the bladder and the rectum. So we're trying to conform the treatment precisely to the target volume and making sure it gets the dose that has been prescribed. On the treatment planning system, we can visualise the doses and the areas where we want to treat on a CT scan of the patient. So here we have a CT scan of a prostate patient, and we have a dose colour wash showing where the dose is in relation to the prostate, which is the red contour on here.
I got throat cancer, and it was November. I had 3 bad teeth, and I had a hurt when I swallowed, so I presumably thought it was the teeth. Had them out. And it seemed to stop, but it was around about late December when every time I swallowed it hurt. Went to the doctors, they referred me here, and that's when they diagnosed it. Okay. The only way it's affected me really is difficult to swallow, and obviously I've got a hard sort of voice, but otherwise no problem. Well, anybody who's going to have it done, just don't be frightened, go through with it, and just try and bear it if you can. And I think if you're strong enough, you'll overcome it. RapidArc
really does revolutionise the chance of improving the patient experience, but also ensuring that actually the full technical armamentarium is utilised. RapidArc gives me the reassurance that the patient's on treatment time is minimalised, which gives me the reassurance that patients have the least opportunity to move. But in addition to that, we can actually dovetail image-guided techniques, which again give me the reassurance that my treatment is being delivered as precisely as possible. My institution has really been at the forefront of delivering technically advanced radiotherapy since I arrived here 11 years ago. We commenced our intensity modulated radiotherapy program in 2001 and have really introduced it incrementally, starting off with some tumour sites and really cascading out to other tumour sites. We've been very keen to cascade the results out to our stakeholders presenting at scientific meetings, really to ensure that others learn from our experience as well as for us to learn from other people's views on our technical implementation program. We've really seen RapidArc and image-guided techniques as a natural evolution in that process, and we're really continuing with our implementation strategy of not simply using the techniques across all tumour sites, being very selective where we want to use it, where we feel clinically it's most appropriate.
TrueBeam is Varian's latest medical linear accelerator, which can deliver treatments up to 50% faster with a dose rate more than double the maximum output of the next best device. Faster treatments allow for greater precision as there is less time for the patient to move during the treatment, as well as making treatment a more comfortable experience. With TrueBeam, much greater precision is possible, resulting in even fewer side effects. For clinicians, there is up to a 5-fold reduction in the number of steps needed for imaging, positioning and treating patients, making the treatment process simple, fast and precise. Complex radiosurgery that typically would take up to 40 minutes to an hour can now be completed in just between 5 and 20 minutes.
The greater the precision and effectiveness of radiotherapy, the less likely patients are to need access to invasive surgery or systemic chemotherapy with all the side effects and costs that those treatment modalities involve. All cancer patients deserve access to the best treatments available, and radiotherapy has developed into a fast, powerful and efficient way of killing tumours while protecting surrounding healthy tissue and organs. Varian's mission is to help save an additional 100,000 lives per year by developing fast, precise and efficient radiotherapy systems that enable more people to gain access to the most advanced treatments available.
There is still only a very small number of consultant radiographers, and the role is very much service driven, so it may not be appropriate that a patient is seen by a consultant radiographer. And when you're looking at setting up the service, it's important that you look very specifically at those patients where the role will work for, and the patients where seeing a clinician would still be much more appropriate for them. Any radiographer or any therapy radiographer is able to refer any patient on to another healthcare professional, but the consultant radiographer is in an excellent position to identify patients where referral is necessary or would be beneficial to a patient. In order to make the referral, you look at appropriate agencies or healthcare professionals either within the hospital or the community, and then normally there is a process to go through, such as a form to fill in or a telephone call in order to get that patient seen.
Researchers and clinicians are constantly striving to find new and more effective ways of treating cancer. As a hopeful world looks for the miracle that will cure cancer once and for all, a major revolution in cancer treatment has been quietly taking place in radiation oncology. A revolution that many consider has seen more significant change in the last 5 years than the field had seen in the prior 30 years. With new research building upon these recent developments, there are many more changes to come. As a result of this revolution in radiation oncology, many cancer patients have a higher chance of survival with a better quality of life. I'm Georgina Burnett, and you've been watching Radiation Revolution.